G'day guys, how I reverse 80 blood tests. Have you got 3 years? No, but we're trying to get you down to some simple things of what you could do. It's not all about me, this is only 5% of the book. We've got 60 patient success stories of reducing MEL scores, fibro scans, coming back from the dead in a coma, to having a good liver. I wrote the book to help people to assess. First of all, assess to address. If you don't know where you stand now, well, what have you got to reverse? Nothing. So just the blood test part. So I say do 71 baseline blood tests now because I know there's 45 from the 2 liver specialists. We don't actually use their referral, we use our own because we put everything together at the review time, and then in between, could be once every 2 months. We also do our ones where we think something's low and there's a good reason to actually get a check on those. Now the GP, some GPs are a wake-up. GP did 71 blood baseline tests then. I don't know how. I've never met that GP in my life. Get to the hospital, David. Catch a taxi. Huh. Okay. Because I had a bad cough. If I didn't have the bung lung, which turned out to be a bung lung, I wouldn't have known that. Because I didn't check for a couple of years and I didn't know what these meant from a couple of years ago, because I had no symptoms. You can't fall into the track of, I got no symptoms, I'm not going to the doctor. If you're doing something bad, like big belly, or alcohol, or hepatitis, well, you got your hereditary, I'm sorry if you've got those, right, and you probably know about those. But, so I wrote my will out. There's a lot more than those. In red, LDL, 3.6 down to 1.4, the world's best. Below your second heart attack level under AHA 2026. Have you read the new guidelines, GPs? Because you won't get your LDL guidelines from the RACGP 2023. They don't give you any LDL guidelines. They just say, use drugs if they're low. Yeah? How low? No. You will with the American, and that's why we're the latest. We try and keep up to date. Australian are all behind, but fortunately there's some great assessment now. Thank you, RACGP. So you've got to know what you're actually going to be reversing. Forget about all the other things. Just blood test here. Are you getting the right blood test? I've had my cardiologist, I fixed up my heart. Fixed up the liver, fixed up the heart. Had a racing heart, they killed me 5 years ago because the alcohol, when you stop alcohol, your heart races. Fixed it. You've got to fix everything. I have perfect diabetes, HbA1c. That's never been a problem. Had the worst cholesterol, now I have the best cholesterol in the world. I know what to do. And I've sifted through the 4 million studies and I've found the ones that lower your FibroScan scores and lower your blood tests. I know what foods to take that lower your liver enzymes, and in the case of albumin and platelets, get them up. Platelets is very difficult. But I've beaten Billy Rubin, world record for me, 15, was up as high as 38. I know what to do. I know how to get most of my blood tests. The vitamin ones are so easy, it's not funny. How are you going to be able to eat tonight unless you know your vitamin and minerals blood test. There's a dozen of those. And the hardest one to shift is iron. But the easiest one to shift is ferritin, trust me. I know what to do, but there's everything in moderation. So your GP is going to give you drugs. Yep, there's drugs. I haven't used too many drugs. I haven't used the Ozempic, statins or anything like that. On my side, it's been natural. But on your side, we've got all the drugs in the book. We're not medical doctors, but we want to give you a list of things. A list of the Ozempics, a list of the statins, a list of the portal hypertension beta blockers. It's not my choice, it's your choice with your doctor, because they've all got side effects, but some of them are very, very good as well. It's not my choice. Make a plan, become your own patient advocate. There's dozens of ways, 250 ways to bring down, in some cases bring up, your blood test. And that includes drugs, diet and exercise. And in the book, we've got the full-blown medical studies, some are 2,000 pages, with the e-book. And that's the world first technology. Yes, cut and paste, and we put them in the book. So medical studies throughout there, but two of these. So that's why we had to do the e-book, to give you 30,000 pages of studies. We've sifted through, we give a grading of 1 to 5 green and 1 to 5 bad. You put your own grading on. You give it to your GP and say, is this one any good? Oh. When you get 20 minutes with your liver specialist every 6 months, say, is this one any good? You've got a list, at least. Do you have a list now? Well, we got something for you. We got the latest drugs from the heart foundations, etc. And some of those drugs, with the American Heart Foundation, they've also got some advice on alcohol and weight loss and what weight loss to do. And we've got guys with videos this year that say how to fix your MASH, which is your steatohepatitis, beyond fatty liver, one step before cirrhosis. Yep, guidelines, diet, drugs, intermittent fasting, all how much the blood tests went down and your fibro scores went down. So we've sifted through all that for you guys. Can't tell you any more. See you in the course.